Hey guys, Dr. Marvin again, here to explain why you need to have a psychologist on your treatment team. I'm sure you already have a medical doctor, right? Someone that when your stomach hurts, you can't sleep at night, you are forgetting things, you have sexual concerns, maybe some diarrhea, you're more than happy to go make a medical appointment and kind of dance around the subject a little bit when you're meeting with the doctor. But generally, we're okay with telling our medical doctor our symptoms. So, that medical doctor will oftentimes look at just one symptom. It's called allopathic medicine. So, they'll look at one symptom and they will prescribe you a medication for that one thing, which is okay. But if that thing is something that you're generating in your head that's creating a physical symptom, treating just the physical symptom is just basically putting a band aid on something. It's not looking at why those things are there to begin with. So let's say you keep repeatedly thinking about something that you did in the past that makes you sad or makes you think the shoulda, coulda, wouldas. You're going to consistently think about that, and it's going to create some depression, which can create lethargy and no motivation and stomach aches, and continue to do this really pretty problematic cycle for you. And then you go to the medical doctor because you're not sleeping well, your sexual appetite is off, or maybe your appetite's also off, and you get prescriptions for those particular things when this could actually be looked at from a different perspective. So, we do need a lot of different people on our treatment team. We may need an acupuncturist. We may need a massage therapist. We may need someone that's doing some wonderful hypnotherapy for us. But we also need that psychotherapist that's going to be challenging the thoughts that you have in your head. Not everything that we think of is true. Contrary to what your little brain wants to think and my little brain wants to think, not everything we think is true. So that psychotherapist should be able to look at those thought processes that are going on in your head, unravel them, challenge them, poke at them, pick them apart, peel back the layers of those onion, peel back the layer of the onion, and really evaluate, is this necessary? Is this true what you're telling yourself? And that might help stop a lot of the physical symptoms that are going on in your body. So, still not convinced? Think about eating a lemon. Think about a big giant Myers lemon, and you cut that lemon in half. Then you cut that lemon again in a quarter, and imagine putting that quarter wedge lemon in your mouth and you're biting down on it and it's super juicy and it's super sour. You're salivating, right? I'm salivating. I'm not eating a lemon, and neither are you. So you're just simply thinking about eating a lemon, and your body produced instantaneous response in your mouth. You started salivating. So anything that we're thinking about is going to produce something in our body physically. We just may not be paying attention to it. So if you're thinking anxious thoughts, thinking stressful thoughts, thinking sad thoughts, they're all doing something in your body physically. That's when we end up waiting too long and we go to the medical doctor because a lot of things are off. We can't sleep, we can't eat properly, we're really tired, we're forgetful, we're not enjoying life anymore. We have sexual dysfunctions, we have all sorts of things going on, weight gain. A lot of these things are actually coming from those thoughts that we have and what our body's doing to help kind of offset that by making something physical out of it. So this is why you need a psychologist or a psychotherapist on your treatment team. Let us look at your thoughts and help you challenge them and help you see things differently so that you can reduce and in some case completely remove some of those physical symptoms that you're actually having. So hopefully I sold you on that. If you have more questions, I cannot talk. If you have more questions, I'm happy to provide more information for you on how to get started with psychotherapy or how to get started with kind of living a more healthy life and looking at those thought processes. Hope that helps. Cheers.